There's things that relate to the doctor-patient relationship, which if we can look beyond ethics and go into law. And the patient in that contract, the doctor has exclusive knowledge because of their expert training, skills, abilities that no patient could ever have. There's a contract between the doctor and the patient that the doctor must always act in the best interest of the patient. When a third party intercedes into that contract, and it's usually a tacit injection of themselves into that contract, a patient does not know, and that the doctor's advice, decision, guidance is tainted by this third party. And it's sometimes very subtle, and sometimes it's smack dab in your face. And I do not like it whatsoever. I've seen it in employment contracts. What you have to know too is that I do a fair amount of consulting with law firms. I do a fair amount of expert legal witness. So I'm privy to certain documents which I cannot disclose. But I will tell you flat out, in certain employment contracts, you've got doctors working under production quotas. They got to make that number every month, or there's consequences, and that doctor's not going to like those consequences. You've got situations where all work is confined to that practice. The doctor cannot refer out to a specialist without the permission of an office manager who may or may not even have a high school education. The patient does not know that they're being short shrifted